Hello everybody, welcome to Medicomania. Today we will discuss the topic that is hyperthyroidism. So let's start with the introduction part. So it is a group of clinical features which is due to elevated circulating hyperthyroid hormone. So that is called hyperthyroidism. The thyroid hormone is elevated. So there are some common causes. The first one is the Graves' disease. Second one is thyroid nodule or thyroid adenoma, and the third one is the multiple nodular goiter and thyroiditis, dequervan or postpartum. There are some other causes of hyperthyroidism. First one is iodine induced, such as drugs amiodarone, and second one is radiographic contrast media, and the last one is iodine supplementation. Now there are extrathyroidal features such as facies and stroma ovari, and TSH induced, there is TSH secreting pituitary adenoma and choriocarcinoma and hydatid mole. The last one is follicular carcinoma with or without metastasis. So broadly there are two types of common causes and other causes. In common causes there is Graves' disease, thyroid nodule, and multiple goiter nodule. And let's start with the clinical features. There are common clinical features and the less common. So common clinical features, there is weight loss, heat intolerance, palpitation, tremor, dyspnea, fatigue, irritability. And there are some less clinical features, that is anxiety, ankle swelling, weakness, pruritus, alopecia, oligomenorrhea or amenorrhea, infertility, vomiting, anorexia and lacrimation, osteoporosis, diarrhea, steatorrhea and angina, and some goiter with fluid. It is a prominent feature of Graves' disease, arterial fibrillation, hypertension, cardiac failure, hyperreflexia, myopathy, Mulbar myopathy, gynecomastia, and oncholysis and spider nevi. And let's start with the diagnosis part. So first line of diagnosis will be serum T3, T4 and TSH level. Second one is the TSH receptor antibody measurement, and that will be elevated in the Graves' disease. Some ECG findings. The first one is sinus tachycardia. Second one is arterial fibrillation, and the last one is radioiodine uptake test, that is tactinium scintigraphy scans. There are some non-specific tests such as aminotransferase, serum or aminotransferase will be raised, GGT, alkaline phosphate, and serum bilirubin. Serum calcium, mild hypercalcemia, and glycosuria. Let's start with the treatment part. The treatment will induce treatment of the underlying cause, the primary one. Antithyroid drugs, start with antithyroid drugs, radioactive iodine, and surgery. And there's some drugs such as beta blocker, propranolol, 60 mg per day, and nadolol. And for the justice, beta blocker is only for the short term period. So alternate is verapamil, and complications such as asthma, and it is the alternate of the beta blocker. There are some specific treatment in atrial fibrillation. And the first one, let's start with the complication of the atrial fibrillation will be the subclinical thyroid toxicosis, thromboembolic vascular complication, and in atrial fibrillation we will start with a beta blocker, and in case of the thromboembolic complication we will give anticoagulants until or unless it is contraindicated. So in thyroid storm, so it is a life-threatening condition and complication of the hyperthyroidism, in which there are agitation, delirium, tachycardia, atrial fibrillation, and fever. So there are some precipitating factor, that is infection is the precipitating factor, and the previous history of hypothyroidism. So we will start with the treatment of rehydration to the patient, and beta blocker propranolol will be given, that is 80 mg per day, and some sodium hypodate will be given, that is 500 per day orally. It inhibits the release of thyroid hormone as well as T3 to T4 conversion. There are some alternate, that is leucosodium or potassium iodate, that will be not much advantageous over the sodium iodate. So preferably the sodium iodate will be used. Dexamethasone, steroid 2 mg per day. That, and lastly one is the oral carbimazole, sorry, 2 mg per day. So that's it from today's video. Thank you for watching my videos.